Hi guys, this is John Adamson, the Rehab Documentation Guru, coming to you live from Kiev, Ukraine, where we continue our adoption journey. Be soon back in the States, looking forward to that. What we're going to do today is we're going to be covering what should have happened here. And I'm probably going to do this periodically to cover some general clinical and critical thinking skills that I believe therapists should have when they approach the care of their patient, and then things that should be translated to their documentation as well. So let's look at this particular patient. This is a patient that was working with a therapist on therapeutic exercises, specifically, as you can see, strengthening of the hip flexors, knee flexors, and knee extensors. Now, one thing I would say about that is, given that this is a patient that is spending a lot of time in a wheelchair, probably not needing to work a whole lot on hip flexor strengthening. In fact, we should probably be seeing a lot of hip extensor strengthening going on, especially since it's a mobility patient. But that's a side point. What I wanted to focus on right now was the cardiopulmonary measures that were being obtained. And it's a good thing that the therapist was taking these measures during the treatment, because it can be a further demonstration of skill. And so pre-treatment, the therapist notes that the patient's O2 saturation is at 98%. And that's normal. And that would maybe be a good thing to note if needed. And then the heart rate at pre-treatment was 87 beats per minute. Now we're assuming, and maybe it's not a good assumption to make, that the patient had been sedentary prior to the initiation of therapeutic exercises. So the therapist got through the exercises, which I'm not going to go into elaboration here, and the post-treatment O2 saturation was 98%. Now that's good. That's staying in normal range. That's what we would expect from a proper exercise activity tolerance. But then we see the heart rate is 62 beats per minute. And this is where the therapist left it. This is what was documented. The exercises were documented, what was done, the skilled technique utilized, but what they did not do is document what follow-up occurred, and I'm going to guess, based on the documentation, that no follow-up occurred. So I'm going to give you just a moment looking at those parameters that were obtained and see if you can think what I'm about to say next should have happened. And I don't have any fancy music to play in the background while we wait. Okay, so let's cover what should have happened, and probably you can guess pretty easily. We had a 25 beat per minute heart rate decline right after exercise. That's not normal. That is a sign of a cardiac insufficiency. The patient was not tolerating the activity well. I'm a little bit surprised that the saturation stayed the same, given the heart rate decline, but the body's a funny thing, and there's a lot of physiology I don't understand, and I know we still don't understand. But this is an abnormal cardiac response, and what should have happened, which would have been a further demonstration of skill, is that the therapist would have analyzed this as being a sign of cardiac insufficiency and should have reported this to nursing and should have further monitored the patient for a time just to make sure that their heart rate came back up to normal resting parameters. So we want to make sure that our clinical findings demonstrate critical and clinical thinking behind them, and then document what our follow-up is going to be when there's an abnormal response like this. Anyway, this is John Adamson, the Rehab Documentation Guru. I hope you found this helpful. If you have any suggestions for future scenarios to be discussed or future topics, please leave a comment. I've had some occasional good comments that have led to videos, and I appreciate all the commentary that you can give, and that's about it. So anyway, for the time being, until we talk again, please be blessed and get paid for what you do. Take care.